The views and opinions expressed by guests on this podcast are their own and do not necessarily reflect those of the host or management. This podcast should not be considered professional advice, and listeners' viewers should consult appropriate professionals for advice tailored to their specific needs.
No, I do. I want to hold it. It's almost like a stress ball, to be honest with you.
And we call it the stress breast.
It is like a stress breast. When is the best time to get a facelift? And is it ever too late? Because there are all kinds of products that we're seeing online.
No.
But what's the best?
And it will take someone's skin that looks 70 and makes them look 50.
Sign me up.
Right.
So I think the key word here for today that caught me was freakazoid. You want to make sure you check their work and that they don't have people that look like freakazoids.
Right.
Don't believe everything you see on social media. That's all I have to say.
Hi, I'm Leslie Lowe. Welcome to Leslie's Lowdown on Life.
All right, welcome everybody to Leslie's Lowdown on Live. Today we've got Dr. Wheeler. He is back in the house. This has been my number one podcast that people ask me about because you are so fun and so animated, and I think people have so many questions. Well, I've got almost 2 pages of questions, and so hi, welcome back.
Thank you for having me again. I really enjoyed it last time. Brought some props this time just in case what we're talking about. But I just think plastic surgery in general, there's so much misinformation that's out there that people think that they know what it is, but then in reality, patients will come in to see me and they'll tell me, oh yeah, I want that Botox filler. I'm like, well, those are 2 different things. Botox freezes muscles and filler adds volume. The Botox filler is not such thing. And they're like, oh, well, that's not what my friend told me. And I'm like, well, shockingly, your friend doesn't know.
Your friend does not know, but I'm going to tell you, which is what's so great is that I think there is so much misinformation out there. And I think the more we know, the better we look.
Yep.
Right?
You know, and this plastic surgery is not for everybody, especially cosmetic surgery. Some people are like, I'm going to grow old and die gracefully, and that's great. I'm going to fight it tooth and nail.
Exactly. And then there's those right down the middle, right? Yeah.
And a little bit of this, a little bit of that.
Whatever works for you. That's what we said last time, and I'll say it until the day I die. Exactly. Whatever works best for you. Yep. So should we start with like
Sure.
some of the questions? Let's start with the questions. So Linda wanted to know, do you get people coming in after plastic surgery saying they regret it? Are there ever regrets?
Yes. I would say a lot of people come in with regrets, and usually it was they kind of went to the cheapest place, or they went to Mexico, or they didn't really do their homework well enough. A really well done plastic surgery in somebody who's an appropriate candidate, they are generally thrilled over the moon. But there are a lot of people who think that plastic surgery is the answer to whatever their problem is, and maybe it's not. So like if your BMI is 45 and you want a tummy tuck, and we tell you no because it's not safe to do that in somebody that's that heavy, you will find somebody who'll do it. You might be able to go to Mexico and get that tummy tuck with your elevated BMI, but your risks of complications are high, the outcome's not going to look great, and they'll regret it.
And then I suppose in that situation, and this is just running through my head, is, if they've got the BMI that's at 45 and they do want to get the tummy tuck, then do you get them on GLPs?
Yes.
Did I say that right?
You get GLP-1s, yep.
Okay, there we go.
So those are the Ozempics, and that's like one of the brands. There's a lot of different brands that are out there. But GLP-1s are, in my opinion, they're a godsend. They're a brand new medication that basically most people lose about 20% of their weight on it, especially if you have diabetes or that sort of thing. But even normal people who don't have diabetes respond to them usually as well. 99% of people respond to them. And it's just been a game changer for our society. So our company started offering medically assisted weight loss because we would have patients come in that we couldn't really do anything for them safely. And they're like, they've been trying to lose weight their whole life. They can't do that. And so finally, it's like, here's something that kind of gets them going.
And which I think is such a godsend for, like you said, for so many of them. And, we were talking about this last time, and it was so many people are opposed to these weight loss drugs, and yet they've helped so many people. in so many different ways, as far as blood pressure and
Heart risk, heart
yes,
attack, all the things.
yeah.
Like I'm on a GLP-1. I have been for 2 years. I have fatty liver disease. So that's where your liver gets replaced with fat cells. It's just a genetic thing that my dad died of it. So I went on it in order to reduce the fat in my liver. And I lost about 20 pounds. And I've been on it for 2 years. You know?
That's amazing.
But nobody would ever guess that by looking at me. And the initial side effects, I tried to really push the dose. I don't recommend doing that. That was kind of miserable.
What does that do?
Well, so if you push the dose on those, trying to get your results faster, you really have a lot of GI symptoms: nausea, vomiting, early satiety, diarrhea, constipation, those sorts of things. But if you really just slowly increase the dose, it takes a little while longer to lose your weight. So most of us are not patient people, but you really are going to have a lot more symptoms. So we do at our office where we're controlling the dosage for you so that you don't get tempted to give yourself an extra shot and that sort of thing. It's also a way that we can control the cost of it more and make it more affordable for people.
So you're saying there's more people than just myself that aren't patient. Okay.
Correct. I'm one of them.
I'm one
as
of them.
evidence.
Instant gratification is what we're always, but I like that you kind of twofold it. So you'll help people with the weight loss. And then in turn, if they still need that tummy tuck or want
Or
that
they
tummy
want
tuck,
that,
then you can do that then.
So when it comes to tummy tucks, just because we keep talking about
Yeah.
it. So this is a fascinating thing when I tell people this. It doesn't matter how much weight I cut off of you at the time of your surgery or your tummy tuck. Let's say you came in, you weighed 140 pounds, and I cut 10 pounds off of you. 4, 5, 6 months later, you will weigh exactly what you did before I cut it off of you.
That's fascinating to
Your
me.
body just redistributes that energy storage somewhere else. So that's why plastic surgery is not weight loss surgery. It's for body contouring. Right. So that a lot of people just don't realize that that's the case.
Yeah, I don't think I understood that either. I just thought, okay, well, you're removing this bulk of skin, so therefore
I'm gonna
you're
be 10 pounds lighter.
you're just going to take off 10 pounds for me.
Yep.
Can we talk about that? No. Okay, so speaking of plastic surgery, Mexico, U.S., because I have an anonymous question. Somebody wanting to know surgery in the U.S. And we did kind of talk about this last time too, but I think it's important to go over it again because so many people are looking outside of the U.S. for those cheaper versions of the same surgery.
Yeah. And they are cheaper outside the U.S. for a variety of reasons, but usually it has to do with safety. So you really don't know if you go to Mexico, is the implant that they're putting in you this same implant that's been sitting on this desk for the past 10 years and that just happened to be the right size and they just washed it off and stuck it inside you? There's a lot of regulations in the United States that are trying to keep you as safe as possible and hoops that we have to jump through. And like everything, the more regulations there are, the more people you need to keep up on the recommendations and all that sort of stuff. So it's all about safety. I have seen people go to foreign countries and get beautiful surgeries. And I've seen people go to foreign countries and get disasters. But I've seen people in this country get disasters. So you don't really have a lot of recourse. You don't have a lot of safety. There's a plastic surgeon that used to work in this area but basically left and now is working in a foreign country. And at the time that they were working here, they weren't that great of a plastic surgeon and they kind of did a not great job.
Yeah.
And that's the person that you would be going to in this foreign country.
Because that's where they can get work.
Correct.
Okay, that makes me nervous.
Wow.
That makes me a little bit nervous. I mean, I understand both sides. People are always looking for a bargain, looking for a deal. But then you're outside of the country. What happens if something happens to you? Then you're in another country.
Yes.
That
You're
sounds
in another
horrifying
country
to me.
and
Yeah.
It's not what I would recommend, but I get it. I get the fact, plastic surgery is really expensive. And I think a lot of people are very surprised about how expensive it is. And it's just paying for, I have 80 employees, so when I'm doing surgery, I can't operate on 3 or 4 people at the same time. I can only do one person at a time. And I have to, support 80 different employees. Now, luckily, there's several surgeons at my practice, so I'm not supporting all 80 myself at that one time. But, that's why things are so expensive because we're supporting the local economy and we have a lot of mouths to feed.
You get what you pay for.
I think
yes.
I think it's a good general rule of thumb.
Okay.
But only to a degree. There are people in our community and outside of our community that are charging 3, 4, 5, 10 times what I would charge for the same procedure.
Wow.
And is what they're doing 3, 4, 5, 10 times better? No.
Yeah.
So yes, you get what you pay for,
no.
but
Do your research.
do your research.
Do your research.
Yes.
I think that is like the best advice that you gave last time was do your research.
The best advice, I say this to all of my patients when they come in to see me for a consult. I was like, at the end of the consult, I say, I have a very direct personality. I say it like it is. For some people, that's too much. But the number one thing when you're going on a consultation with a plastic surgeon is that you feel comfortable with that person and how they communicate, right? Because something can happen with any surgery that you do. And if you already don't like that person or distrust that person or have like your spidey senses up, don't do surgery with that person. I don't care how cheap it is.
No.
Run, right? Make sure that you have a good communication with them is what I would say.
And I would just think that, I mean, me personally, I would want somebody to be direct. Be direct. Tell me, don't sugarcoat anything because the more direct you are, then the more informed I am. It's kind of how it.
Yeah, but some people take offense to that.
Yeah, well,
They-
yeah, I
they go to
suppose
their
so.
car.
Yeah. Okay. All right. I guess I'm not one of those people. So you've got the breast implants
Yes.
out here in front of me, and this is kind of twofold. But we do have a question on here, another anonymous one, but wanting to know if you get a breast lift, do you have to get breast implants to get a breast lift? And I thought, oh, that's an interesting question. That'd be one I'd ask.
So the idea of a breast lift, where is the position of the nipple relative to the rest of the breast? So if the nipple is pointing to the floor, then you need a breast lift to bring the nipple back so it's pointing straight and forward again. That does not add any volume to your breast. So a breast lift doesn't make your breast bigger. A breast augmentation or using an implant makes your breast bigger. So just by filling up your skin, it can lift your breast if you're talking about the actual volume that's there, but it does not lift your nipple.
Okay.
So it's called the pencil test. So if you pick up, I'm going to borrow this pen. If you pick up your breast, you stick the pen between where your breast hits your chest wall, you let go of your breast, and then you let go of the pen. If the pen stays, you might need a breast lift.
Okay.
If the pen drops, then you don't.
Okay. That's actually really good information.
It's called the
Yeah.
pencil test.
So I read that question and I thought, oh, yeah, that's a really good one. I guess I think I was wondering the same thing.
So breast augmentation adds volume, breast lifts move the position of the nipple.
Okay, since we're talking about that, you've got all the different breast implants right here, which is fascinating because I've never looked at one like that.
So so this is a saline breast implant.
Okay.
And this is all we had in the United States from 1992 until 2006, unless you were part of a study. And so a lot of things happened in the United States that didn't happen in other parts of the country. So a saline breast implant ripples really significantly. So you can see that this has a line down the middle of it. And literally you can sometimes feel that through your skin, especially when somebody has really thin coverage. So when all we had was saline breast implants, we would always put them underneath the muscle because we're trying to hide this lumpy mattress from the outside world. Silicone breast implants also ripple, but they don't ripple as badly. In fact, they kind of bounce back to how they were supposed to be. And like 6th generation silicone implants really hold their shape pretty well.
Yeah.
The difference between these two implants, this is a smooth round implant. This is the most common implant used in the United States.
Okay.
Where most other countries that never had silicone implants taken off the market are using these, which are textured anatomic implants that give your breast a more natural breast shape because the upper pole fullness is lacking. So that looks more like a breast than a round thing.
Right.
So I call this a European style breast augmentation. It's usually what I do for a lot of patients and kind of what I've become known for versus the stuck on, too big for their frame or just too full in the top appearance.
Yeah.
So this is called an anatomic implant. There are some disadvantages to them. The texturing that's on it can put you at a risk for a very rare disease called ALCL. It's a rare form of lymphoma. I've never seen it. None of my partners have ever seen it, but it does exist. And this one I brought purposely because it has a hole in it. A lot of people wonder about when their implant starts leaking. So if you can see this does not want to come out.
No.
This is very different than how implants used to be. So this is a highly cohesive breast implant, or also known as a gummy bear breast implant. They should really call it a Jell-O breast implant.
Yeah.
Because just like a gummy bear is not this soft, right?
Right.
But if you were to put your finger in Jell-O, you could actually go into it, but
Yes.
then you would have a sticky residue.
Then you've got that. Interesting.
So they should call them Jell-O breast implants.
So this is your preference right here would be.
Yeah, I mean, that or this one that takes on somewhat of an anatomical shape when it's in there because of how soft the gel is. So it has a similar thing without the risk of the ALCL. If
Okay.
It really freaks somebody out.
So I guess I have a question because I know that you do a lot of breast reconstruction for cancer patients. I know I do. I want to hold it. It's almost like a stress ball, to be honest with you.
So we use
Okay.
we use an implant when I'm injecting people with like fillers or Botox. We'll give them one of these implants as a stress, and we call it the stress breast.
It is like a stress. I can see that seems weird,
But you can see
you know what I mean.
difference between the two,
There
right?
is a difference, yes.
One feels like a boob.
Yes.
And the other one feels like a backwater.
Feels like, yes.
That's
That's
why we don't
exactly
really
what it
do
is.
scaling that much.
That is so interesting because I've never done this before. So that it's just like, okay. All right. So when you're doing like breast reconstructive surgery, because I know that things have gone, they've come a long way in the last several years.
Yes.
So what is like your choice, or does it depend on their body, or what kind of cancer they had, or how much they've been through?
Yeah, it doesn't depend on how much cancer they have,
Okay.
other than if you have like metastatic breast cancer and it's in your brain and your liver and your lungs, we're not going to do elective surgery on you. We need to really focus on your cancer treatment. So as long as your cancer is in an early stage, we're really good at curing breast cancer. If you're a stage 1 breast cancer, you have like a 97% 10-year survival rate, right? So we can put the focus on the appearance, on getting something out of this, the breast dog they never got, but they've always wanted, or whatever the thing is. We can make that more of the priority, or at least make it a priority. Obviously, getting rid of the breast cancer is the priority. But as far as like the type of implant we use or how we reconstruct them, it's just very patient dependent. We usually either use their own tissue, which is usually from their abdomen, or we use an implant if they don't have any tissue from the abdomen, or they want that shape.
Yeah. And again, we talked about this last time, preference as to what each individual does. I do love that you can take, skin and tissue from somebody's own body and then do that kind of reconstruct. That's fascinating to me.
So just like she and I have talked about her potentially coming and watching a surgery just to learn more. And in that particular surgery, I'm going to take the fat that's in their sides out, and I'm going to transfer that fat into their buttock, not to give them a giant butt, but just to help with the shape, because when you lose a lot of weight, your butt becomes very flat. Yeah. And so when I do a body lift and I lift all that skin up, if I don't put any fat back in the butt, they still have a very pancakey butt. And so a lot of people, when they hear gluteal fat transfer, they think of, the Kardashians or whatever with the giant butts. That's not what we're going for. We're just trying to give it a shape. So I'll take the fat from one location, I'll transfer it to a new location, and it will live in that location and take on the characteristics of that location.
That's amazing.
So we'll do it also for facial fat transfer, for when people have lost a lot of weight in their face.
And you can take that again too, and then put it, say, in their
face,
cheeks and wherever.
Do it all the time.
That is so fascinating to me. I guess I'll take this moment here too to say, get your breast exams.
Yes.
Right?
It's not October yet. Yes.
But do get your breast exams. I always think that's so important. You have some different fillers here. And I didn't know this. So we were talking about this before we got started, that there are different fillers for different parts of your face.
Correct.
Did I get that right?
Yep.
Okay.
So these particular fillers have a difference in density, and they're all expired. So I figured I would just waste them all.
Okay, let's go.
So because a lot of people think that if they just get a syringe of filler, they can put it wherever they want to put it.
Right.
And you can't do that because the fillers have different properties for different purposes. So if I take this is called Volux. This is one of the stiffest fillers on the market. We generally use it in the jawline and in the chin.
Okay.
And if we look at, when I squeeze it out, you see how it wants to hold its shape.
Yeah, it's thick.
Okay, super thick. Where this one is called Redensity. This is one of the thinnest ones on the market.
Oh, yeah.
And you see that over time, it's wanting to like flatten itself back out. So if I put this in your chin, it's not going to do anything. I could put it really superficially, like right underneath the teeny tiny little wrinkles.
Yeah.
But I can't put it down on your bone. It's not going to hold its shape.
So where would you put the...
So I would use the Redensity, the really, really, really thin one, directly underneath each individual little teeny tiny like wrinkle in the skin.
Okay.
So it's like in the dermis. I'm super duper duper superficial. Where for the Volux, I'm on the bone. And then there's ones in between. So like if I was going to do somebody's lips, I would oftentimes use not that thin and not that thick.
Somewhere down the middle.
Somewhere down the middle. And that one is somewhere down the middle.
Ah, that's cool.
And then
I did not know that.
This product really wants to stick.
It?
Yeah, really wants to stick to itself. Where that one is like water.
Yeah, that's like water.
Yeah.
Okay. Oh, that's fascinating.
So you can see how
that one's really
it's holding this, right?
So this is the one you want closer to your bone then?
Correct.
Okay.
And that one we go in lips, and this one goes really superficial.
Wow. That's awesome. Just going to rub that in.
Yeah, rub that in. So it's actually hyaluronic acid, right? So hyaluronic
well, there
acid,
we go. That's
right?
good for your skin.
Correct.
Which I
So
need to go get some more of.
it's definitely not going to hurt anything to have that. And I like to use hyaluronic acid fillers, and the reason why is they make an enzyme. Oh, I should have brought that. That would have been kind of cool.
Oh, yeah.
They make an enzyme called Hylenex
Next time.
that you can put on this, and it will eat it. So it would turn it from this jelly-like consistency to like water.
So if somebody has too much filler or doesn't like how it is, then you can
dissolve it.
Dissolve it.
Right. And so that's why I like hyaluronic acid, because one of the main complications of fillers that can be kind of scary is if you get it into a blood vessel. If you get it into a blood vessel, you can cause necrosis of that distribution of that blood vessel. And if you're using a filler that you can't dissolve, there's nothing you can really do other than pray. Where this one, I can flood the area with a dilutional agent and usually reverse that process.
Okay, so hyaluronic acid compared to what are the other ones?
The other fillers that are more permanent are like something called Bellafill, Radiesse, and Sculptra.
Why would you want to use those?
I don't.
You just
I just don't.
You don't. You just don't. Yeah.
There's a lot of people in the town and nationwide that like Sculptra's had a huge marketing push, so there's a big social media presence for it right now. I don't like to use it because I can't reverse it. It's not super thick, so you're not as worried about it getting in the blood vessels. But if you don't like it, I can't reverse it. But more importantly, when I come in to do a facelift later, that Sculptra creates little teeny tiny adhesions and scar points that make the surgery much more challenging and more difficult. So knowing that one day somebody might want to have a facelift, I'm not going to use this product in them because that's going to make whoever does their facelift later, if they get one later. But then they always say, oh, well, I'm never going to get a facelift. Trust me, the number of 40-year-olds that say they're never going to get a facelift and then end up getting them is high.
It's pretty high.
It's pretty high.
It's pretty high. Higher than the amount of facelifts that have increased over the last year, because we were talking about that.
Yeah, so she had asked me, one of the questions
was have you seen an increase in the amount of facelifts over the last, several years?
I think no. So the national statistics show a 1% increase from last year to this year in facelifts. I think what's more important is that facelifts have a stigmata that you're going to look pulled and tight and weird, like Joan Rivers. Where in reality, a good deep playing facelift, the ones that we talked about last time, they just look young, refreshed, they look great. So
they actually do.
I think that people, as they're seeing that, they're like, okay, do I really want to look like my mom for the rest of my life? Or do I want to look like I used to look 10 years ago? Yeah. And that question's pretty easy to answer for most people if it's important to them.
Yeah, Jim had asked that question. He also said, do you think that if there were an increase in facelifts, if it were due to social media?
Yeah, I think that social media, the deep playing facelift is definitely, there's a big push out there right now for that on social media. There's several very talented facelift surgeons who are gaining a lot of traction, and then the celebrities are being more open about what they've had done. So when you see the people who have had that work and you're like, wow, they look really great, it's not so scary anymore, as opposed to being secretive about it.
Yeah, that's so true. Okay, so we also had a viewer that wanted to know when is the best time to get a facelift? And is it ever too late?
Yes, it definitely can be too late. I tell people sometimes when they come in, they're 75, they've never done anything, they never used sunscreen, their skin looks terrible. It has all the little crepe paper appearance.
Crepey, yeah.
So if you pull that skin tight to get rid of the heaviness that's there, it looks really strange. You look like you got caught in a wind tunnel because all of your vertical lines on your face from aging then are now sideways.
Oh.
So you want to do it before you get a lot of those lines in your face so that you can put it in the right location so that then you don't look weird. So the ideal time for a facelift is somebody who looks to be between 40 and 60.
Okay.
Okay. So people who look old for their age would get it closer to the 40, and people who look young for their age would get it closer to the 60.
Okay.
But that's, in general, when we start to think about it. And usually, facelifts are it's the jowl. It's this heaviness that's right here,
it's that thing
combined with the neck, right?
Yes.
So when your neck is really bothering you and the jowl, a facelift is what fixes that. A lot of people think that a facelift is also a brow lift. We oftentimes do those together, and some people say that's a full facelift. Let's not confuse people. A facelift does the jawline and the neck. A brow lift does your brows. And sometimes you have to do both, because if you go to do this and it gets all wrinkly up here on the sides, you need to have that as well. So sometimes we do recommend a brow lift at the same time as your facelift, especially if you're on the older age of that.
So I forgive me, because I can't remember if we talked about this last time, but if you have a facelift, you're saying, I know we had a conversation, I can't remember if it was on camera or off camera. Do you still need to do the fillers and the Botox?
Yes. So a facelift does something very different than what filler does, and does something very different than what Botox does.
Yeah.
Botox paralyzes muscles. We paralyze the muscles associated with lines of animation that we don't like. So usually it's for between your eyebrows or the crow's feet, and sometimes the forehead lines.
Yeah.
So if you do a brow lift, you may be able to get away with less Botox for your forehead lines, because you've taken away while you're getting the forehead lines. But eventually you'll probably still want to do some Botox here and there. Filler, when I'm doing a facelift, I oftentimes will transfer fat to someone's face at the same time, which is volume, and so is filler is volume. So that fat transfer kind of makes them not have to have filler for a while, but then over time they lose some of that fat in the face, because we lose bone and fat in our face as we get older, and they might need some filler again. So it definitely helps, but you're not going to get out of it, so you don't have to do anything ever.
Right. There's still some little tweaks. You got a little maintenance that you've got to do.
One of the main maintenance you need to do is skincare, right? So we were going to talk a little bit about retin-A, retinol, all of that sort of stuff, to understand how that works, why somebody should use it. So recently you've started using retinol again?
Yeah, I started because I was really inconsistent with it.
Yep. And
And then I started using it very consistently after our last conversation. I noticed a big difference just in the texture of my skin.
Yeah. So
Yeah.
how retin-A, so first of all, retinol and tretinoin are very similar, but they're not the same. Think of the retinols as a weaker version of the prescription strength tretinoin. They both do the same thing, which is to tell your skin to turn over more quickly. So to get your skin to turn over more quickly, the healthy, thick layer of your skin has to be about 20 to 25% thicker, because the lifespan of the cell is shorter. So they're turning over more quickly. So during that time, during the first 3 to 4 months that you're using the product, you're going to get more pimples, more breakouts, more redness, because your skin is having to turn over more quickly.
It is true.
The outer layer of your skin, the dead layer of your skin, is going to become thinner, because your skin cells are turning over more quickly, which is what gives you a healthier glow to your skin and less of that roughness. So by using those products, you're going to make your skin thicker and healthier, and therefore that textural quality of your skin is going to be improved. And as long as you're on it, it will stay that way. But as soon as you stop it, it will go back to its normal life cell. There are basically, I say there's 7 levels of retin-A, retinol, all those different things. I usually start people around level 3. I like a product called Skin Better Science Alpha Ret. That's usually what I start people on at our practice. And then you have to go into the prescription strengths, but you don't want to go to the pharmacy and just buy a bottle, or Mexico and buy a bottle of retin-A.
That was my question.
It's super duper duper harsh.
Okay.
So what will happen is you'll start using that, and because there's not other things in it to make it not so intense, most people bail out of it, because it makes their skin really red and really inflamed and really irritated, and they can't take it. So we have products that are mixed in with other products, so that when you're using it, it's not as intense on you, but you're still getting the same effect.
Okay. So with the retinols, retin-A's, help with brown spots. Sarah had a question. She was like, does that help with age spots?
Yes.
Okay.
So I think everybody, if they can afford it, it's not that expensive, but if they can afford it, they should be on a retinol or retin-A, as well as skin sun protection. If you're not going to protect your face from the sun, don't even bother doing any of this. It's a total waste of money. But if you're going to protect your face from the sun, you should be using a retin-A or retinol, the highest dose that you can. You start with it every other day, and then you eventually do it every day if you can, and then you go up to the next level, the next level, next level, until you get to the highest level that you can tolerate. But it helps with age spots. It helps with the texture of your skin. Brown spots also have a different thing that you can use. There's a product called hydroquinone. Now, if you're using hydroquinone all the time for the rest of your life, you're going to cause some problems with your skin. So you want to go on and off of it from time to time, but that's what really helps with the age spots.
Okay.
With the brown spots.
Okay.
It's bleach.
It's
But it's not bleach, but
it's a bleaching kind of product for your skin.
Yes.
Okay.
Hydroquinone.
And retinol, you just continue to increase until.
So we have a cream that we carry. It's called Skin Brightening Cream. So it has hydroquinone and tretinoin in it together, as well as some other things to make it so it's a little more soothing. But I wouldn't want you to be on just that one product for the rest of your life.
Right.
You'd want to cycle in and out of that product.
Okay.
So you'd want to do that like in the fall and winter, get your skin nice and shiny, get a little IPL, intense pulse light, that's going to help the brown spots to fall off. And then, but it's a constant, you're going to constantly be having to do something for it. There's nothing that just makes it go away and it never comes back.
And then it just never comes back. I wish that would be lovely.
Right.
Okay, you just said IPL. Tell
Intense
me.
pulse light. So
Okay.
it's basically just a really, 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 really bright light. But it's so bright that it actually damages your skin in a good way.
Okay, so last time you had the red light
Yep.
mask, which everybody loves.
So the red light mask, right? You put that on and it just feels a little warm and
Yeah.
that's it. IPL, it's almost like it's not a laser, but it's like a laser in that it's like someone's dropping a rubber band against your skin.
Oh.
So it's like, ow,
So like,
ow, ow.
just like somebody's
Yeah.
like doing
it's not
that
the end of the
to you.
world, but it's not like soothing, right?
Yes.
Where the red light mask, you could put that on for 15 minutes and it's not going to hurt you at
Yeah.
all.
Nobody's poking you.
Right.
Okay, Sarah's other question was, and I'll take it back to the crepey skin,
Mm-hmm.
and I think not just for your face but for your body. Is there a good way to combat that? Because there are all kinds of products that we're seeing online.
Yeah.
But what's the best?
I would say, so anything that is not sold from a doctor's office can't have enough of the effective ingredients in it because you're going to potentially have side effects associated with those ingredients. And who are you going to call from Bausch and Lomb or whatever,
Right.
If you're having a reaction to that stuff. So all of the oil of Olay and rock serums and all that sort of, they have a tiny amount of the active ingredient in it, but they're capped at how much they can have in
Yeah.
them. So anything that you're not getting from a physician isn't going to have a lot of the stuff that actually does stuff in it.
So you're going to have to use a lot more of it just to get
And even then, maybe because the concentration is so low, you're not going to get the effect that you would get by having the higher dose. And honestly, the stuff from the doctor's office is not more expensive. So I don't know what we're trying to do here.
It's true. I mean, maybe it might look more expensive, but you use less of it.
Mm-hmm.
And I mean, I always just tell people, spend the money on your skin.
Yes.
Spend the money. You're going to have it. You want to have it around for as long as you can.
Yep.
And you want it to look as good as you can possibly have it look.
Yeah,
So
and don't stop in your face. Go all the way down
go
your
all the
décolleté.
I've learned that the hard way. I'm working on that one too. Because I mean, maybe for a time I wasn't so good at that.
I just don't think that people think about it. Right?
Yeah.
They think about their face, but then it stops.
Right.
And then what will happen is you'll start to get a discongruent
it's
matching between
different.
the face and the chest.
Yeah. Yeah.
And the face skin is different skin than neck skin. So like one of the things I do for somebody who's been out in the sun for a long time and has a lot of radiation damage is to reset their skin. I do it with a really deep chemical peel that you're under sedation for. Like we literally knock you out for me to be able to do this peel.
Really?
Yep. And it will take someone's skin that looks 70 and makes them look 50. It's ridiculous.
Sign me up.
Right. It's
like,
absolutely
cool.
ridiculous. But there's obviously a recovery associated with that.
Right.
So like the things that we offer and the things that we generally do are not the things that are just, I'm going to go in for the afternoon facelift.
Right.
Right. Like that stuff doesn't do anything long term.
It may be for a minute.
Yeah, maybe for a
Right,
minute, but
yeah.
it's not like they're charging you $3 to do it, right?
No.
So it might be cheaper than a facelift or whatever the thing is, but your result is 1/10 of what the other stuff is.
So who's a candidate for this?
Anybody who has significant damage on their face from the sun, and who has the time and the effort to go through the recovery process.
And you would do the face and the neck and the
So
no.
neck skin's different than face skin.
Okay.
So face skin is sebaceous or oily. And so you have deeper glands on your face that when you literally burn off the top layer of your skin, you have all of these deep glands that come up
Right.
and repopulate the area. You don't really have that as much on your neck or on your chest. So your margin for error is very small on the neck and the chest to get an improvement,
Yeah.
but not burn them. So
Yeah.
faces, yes, very judicious on the neck.
Okay. Okay. What's the recovery time on something like
So
that?
it used to be really terrible. There's this guy who showed me how to do you look like an alien, literally, for 7 days. So we put this green mask on your face that sticks to your face. And what that does is when we've burned your skin, we need to seal it. It's like a paper cut, right? So if you have a
Okay.
paper cut, it hurts every time your paper cut's opened up. But if your paper cut, you put super glue on it, it doesn't hurt that much anymore because you're not exposing the underside of your tissues to the air. So you have a giant paper cut on your whole face. And so we're putting this mask on that, it's a mud mask that sticks to your face for a week. And what that does is it makes it so that it doesn't really hurt. It also, when you burn someone's face, it weeps. So it's all oozy. This is stuck to your face, so it's not weeping and getting on
So
everything.
you don't have any of that.
And you look like a freakazoid. So like you can't freak out because you can't see anything underneath it. So it helps with the mental side of things. And we give people a bunch of Valium and say, just sleep it off.
Just sleep it off.
It'll
Just
be
take a
okay.
week and get some rest.
Take a week, get some rest.
Just you're getting refreshed in every single way right here.
When the mask comes off at a week, your face is very red, but it's like brand new baby skin. And so you have to really protect it like a brand new baby. You wouldn't leave a brand new baby out in the sun, right? So you want to keep it out of the sun, keep it protected, and it feels kind of red and irritated. Babies are easily irritated.
Yeah.
So if we've given you baby skin, you have to treat it like baby skin. That redness is variably and how long it lasts. You can, about a week or two later, start to put on cover-up where you're hiding the redness, so you're not seeing it. But when the cover-up's not there, you're going to see the redness.
You're going to see the redness.
Yeah, and that takes anywhere from, 3 weeks to 3 months for someone's redness to go away, sometimes even longer. If somebody has rosacea or the redness of their skin at baseline, they might have it for longer.
But it's so worth it. In the end, I mean, if you're looking to do some major repair work, 2 weeks is nothing.
What I should do is I should send you guys a before and after picture of a person's skin with it, and let you guys, the viewers, be able to see that and be like, yes.
Oh, let's do that.
Okay,
We'll put it on. Yeah, that'll be a good one. You should also follow Dr. Wheeler's Instagram account, because if you want to see some stuff, it's fascinating.
Although you're probably going to get lots of naked pictures, so be careful.
Well, I mean, you're talking breast implants and tummy tucks and stuff like that. So, I mean, if you're a covered body, you're not going to see it. But no, really, I love to go through and look and see the work that you've done.
Thank you.
It's super fascinating to me. So I am going to come in and watch the surgery.
Yeah, let's do it.
Yeah, we're going to do it. And we love everybody's questions. So keep them coming, because you're coming back.
Sure.
We're going to do this again.
Did we get through them all?
I think we got through them all. I'm going back through. Has the amount of breast lift surgery compared to, I think we got through all of our questions. Oh, what are the changes? What are the changes that you've seen
In plastic surgery?
in plastic surgery? And that one is from Morgan.
Okay. Back in 1900.
Back in the old days.
It's like any science, right? It's constantly evolving. And so literally my own practice, I do things very differently today than I did even 5 years ago. So a deep plane face and neck lift, we didn't do them when I was training.
Okay, talk about the difference between deep plane and then just a regular facelift.
Okay. Well, it's hard because I'm going to use a bunch of terms that nobody knows what they mean. And so that's not going to be very helpful. But basically, it used to be that we were taught to make our incision around the ear, lift the skin way off the face to here, tighten up some of the deep structure, and put the skin back down. Okay, that's a traditional facelift or a skin-only facelift or even a SMAS facelift. Don't ask me what SMAS stands for. It won't make any difference. But basically, it's the thick, tough layer of your skin underneath your skin, not of your skin, but of your face that your muscles insert into. It's the fascia. It's the gristle in a steak. It's the thing that can actually hold tension where skin stretches. So if you put any of your tension on your skin, it's going to look like you didn't do anything in 3 to 6 months. These are your mini facelifts. These are your lunchtime facelifts. These are why we don't do them. So a deep plane facelift, what you do is you go underneath the skin for a very short distance, and then you go underneath that thick, tough layer. And you go underneath that thick, tough layer all the way to the very anterior portion of your face. So you're releasing the ligaments that are restricting your face that occur at your cheek and occur down here at the the mandible.
Where it's supposed to go.
And so all the way to here. But I'm way, 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 way deep underneath your skin. Now, the scary thing about that is I'm directly on top of your facial nerve when I'm doing that. Your facial nerve is the nerve that controls all the movement of your face. So basically, back in the day, everyone's like, we don't want to permanently paralyze somebody. Stay away from that area. But that's what you have to do to get the better result. But to do that, you have to be really careful while you're doing it. So the surgery takes a while, and that's why it's so expensive. So I'm very carefully going all the way to the front to release all those ligaments that are in place. So then gently just lay that thick, tough part of your face back down in its new location without really any tension on it. And that's why it lasts so long, and that's why it looks so good. As well as going in and taking out things like your submandibular gland and the fat that lives underneath your platysma to give that really snatched, sharp jawline.
Okay.
Yeah, I use the word snatched, sorry.
He did.
Yeah.
I'm just going to do this. Last time we used the little.
Yeah. And that was just imitating what,
Right.
it's like, but for me, like I have a much heavier neck than you do because this is my submandibular gland right here, that fullness.
Okay.
And so I can feel these hard knots. And so if I were to be able to get rid of those, I would have a much sharper jawline.
Ah.
So for
see?
some people, they have a big submandibular gland.
Right.
No amount of pulling on your skin is going to change that. We'd have to trim the bottom of the gland in order to give you a sharper neck.
That sharper neckline. Okay, so parting thoughts for anybody, and I know there are a lot of people who are opposed to plastic surgery, and again, that is
Different
so
strokes, different
fine.
folks.
But there are a lot of people who are entertaining it. They have questions, they have fears.
Yes.
So, what would you tell people that are considering they've got those questions, but they have those fears?
I would just say go in for a consult.
Yeah.
There's nothing committing you to doing the surgery, right? Go talk to somebody who's knowledgeable, that knows what to do, how to do it.
Yeah.
Look at their before and afters. And if you look at the before and you look at the after and you can see a nice difference and you think that they look good and normal and not freakazoid, well, then you're probably going to be okay. And in all of my time, I've never had somebody tell me I did too much when I was doing facial surgery. If anything, some people wish that was even more.
Yeah.
So usually, if they're disappointed, which usually they're not, but if they're disappointed, it's like, I thought it was going to be even more.
So I think the key word here for today that caught me was freakazoid. You want to make sure you check their work and that they don't have people that look like freakazoids.
Right.
Yeah,
If you
it's
look at
true.
their work, their
Yeah.
before and after, and you're like, ooh, I don't think that looks very good,
Yeah.
then I probably wouldn't go to them because they're posting that. So they obviously
Yeah.
think it looks okay.
Yeah. And I'm going to use the base as Madonna and her,
I think Madonna has way too much filler in
yeah.
her face, or it's just too puffy. It doesn't
Yeah.
look like she used to look.
Yeah. Okay. So we're going into fall.
Yep.
This is how we're going to wrap this out because we'll be back and we'll be back in the fall, headed into winter months. So, what recommendations do you give people headed into a new season?
Yeah, so a fall is a great time to focus on your skin.
Yeah.
So things like IPL, skincare, if you're going to do one of those big peels, it's a good time because you're not in the sun as much.
Yeah.
Spring and summer are the times when you probably don't want to do that very specific thing to your skin because you're going to have a harder time avoiding that. So spring and summer, spring bodies are usually like, okay, it's bikini season.
Right.
Let's do the boobs and do the abdomen, all of that. And fall and winter is more like, okay, let's get the skin looking its best.
Okay. I love it. I'll see you back here in a few months
That
if
sounds great.
you'll be back, right? Okay, done deal. Keep those questions coming.
Yeah.
Dr. Wheeler, thank you so much. You're
Thanks for
always so much
having
fun. You have the best information. And you're right, so much incorrect information out there. Don't believe everything you see on social media. That's all I have to say. Go make the rest of your days the best of your days.